We've got a case curve at the moment that is stubbornly staying, unfortunately, high given the current state of restrictions in Sydney. I first want to just draw your attention, though, to the hospitalisation numbers in New South Wales because they're ticking up at a bit of a pace now. We've got 37 people in hospital and 7 of those are in ICU, intensive care, serious enough to require that really close monitoring and intervention. The other thing that the Chief Health Officer, Dr Kerry Chant, said today is that about a fifth of these people are under the age of 35. So we're seeing that this virus at the moment is spreading through younger people rather than, as a greater share of the cases than you sometimes see, especially early in outbreaks. You often see it spread through younger people more than older people. And a lot of those people are ending up now in hospital. So that hospitalisation number, it's the highest we've seen in New South Wales since that first wave when we were first coming to grips with what exactly this coronavirus is. We've not seen hospitalisation numbers quite so bad. And that, given the trend, given the way we know how these outbreaks work, that's going to get higher before it gets lower, unfortunately. New South Wales cases today, we're looking at about, again, as I say, stubbornly high, 27 cases today. A lot of these cases out in the community while infectious. Let me show you that one quickly. We've got 14 of those cases spent part or all of their time while infectious out in the community with capacity to spread this virus onto others. So again, another step backwards from yesterday. Stubbornly, this virus is sticking around. If you look at the 7-day average, a good way of just measuring the trend line here, rather than focusing on sort of one-day movements, you see we're still, again, seeing about 26 cases a day on average, and it's been about that level for about 4 or 5 days now. So you can see it's not really any surprise. We were talking about yesterday that we sort of expected that the lockdown restrictions would continue in some way, shape or form. We're just not seeing the improvement that we need to see. And there's lots of reasons for that. We'll get into some of those. One of them, I think, is that New South Wales Health is still not systematically doing the double ring fencing that many other states have now been doing to great effect. South Australia's been doing it, Victoria's been doing it, where you put not just the close contacts of cases into isolation for 2 weeks, but you also send the close contacts of those close contacts into isolation. That's been kind of on a bit of an ad hoc basis, some being sent into isolation, some being deemed as casual contacts. But getting that double ring fence is going to would hopefully reduce the number of people that you see out while infectious quicker. We're just not seeing that happen. That's not the sort of systematic approach of New South Wales Health.
Instead, what we're seeing is health authorities naming the Liverpool, Canterbury, Bankstown and Fairfield local government areas as particular areas of concern to them. Why is that?
Yeah, so what we're seeing, the health authorities have named those 3 local government areas in particular as concerns. What we're seeing at the moment is when you look at the local government, the councils that these cases are happening in, what we're seeing is a trend away from the eastern suburbs of Sydney. So Waverley Council has had 25 cases in the most recent 7 days that data's available for, which is there's a bit of a lag on that. We don't have today or yesterday's data there, but 25 cases in a 7-day period, and that's 8 less than the previous 7-day period. The City of Sydney has had 8 and it's 7 down on the previous period. Woollahra as well down on the previous period. What we're seeing, an increase in Randwick, but particularly an increase in Fairfield, 14 cases in the past week. That's up 12, so 2 in the previous week, 14 in the past week. And then Canterbury Bankstown, 14, that's up a little bit. Liverpool down a bit, but from what health authorities were saying today, it sounds like that there are more cases in the Liverpool area in the last couple of days that are yet to be put into the formal data published by New South Wales Health. So we're seeing a move away from the eastern, wealthier suburbs of Sydney, and this virus is now spreading in the western suburbs. And for people outside of Sydney, I just pulled a couple of figures. So the Waverley Council, just to show you how different the demographics are in these areas. Waverley Council, 68% of people in that council speak English at home. Woollahra, 75% of people speak English at home. But come down to Canterbury Bankstown, only a third of people there speak English at home. In the Fairfield Council, 24% of people speak English at home. So you're seeing very different demographics. These are the kinds of areas that we saw stubborn, long infection happening in Melbourne through the middle of last year. One of the reasons that cluster, that outbreak, that wave was so difficult to bring under control was because it was spreading through communities that weren't really being communicated with effectively in Melbourne by Victorian health authorities, and Dr Kerry Chant said basically the same today, that they haven't been communicating with people in these areas perhaps as well as they have in parts of eastern Sydney. So there is a real risk that we'll see the eastern suburbs cluster kind of come under control, only to see another one happening in Western Sydney, which will prolong that lockdown for everyone.